Hello, everyone, and welcome to another exciting episode of the OIG Roundtable. I get confused whether it's OIG Roundtable, OIG Files. At the end, it doesn't matter. Four old guys from the OIG talking a lot of stuff about fraud, waste, abuse, and compliance. Thanks again for joining us for our podcast. As always, I am joined by Matt Kachansky, Jason Eisengrein, and Wade McFall. I am Eric Rubenstein. I'm the Senior Director of Fraud, Waste, Abuse Litigation Support here. Jason is our Senior Director. Matt Kachansky is one of our directors. Wade McFall's our directors. We got a lot of directors here. People are running a lot of their own stuff here. And today's OIG Roundtable, we're going to talk a little bit about sort of OIG, but really SIU related operational things. You know, we field a lot of questions from our clients on our SIU side, on our payer side, a lot of prospective clients where they talk about process improvement and the like. You know, we've done a bunch of projects here at Advise on process improvement within SIUs. And what we've generally found is that, you know, there really isn't a standard, and there really can't be a standard because every case is different. Every plan that operates is a little different. You know, when we're talking about things on the government side, let's start with the UPICs. Most people understand the Unified Program Integrity Contractors. But when we're talking to prospective clients about the fact that we do a lot of work with the UPICs on our operational side, and Matt and Jason, as you all know, outside of being retired from the OIG leadership, also ran the UPICs, Jason on the western side and Matt on the northeast side. What people sometimes don't realize when we talk about that is we basically say that the UPICs are the SIU of Medicare, and that kind of puts a light bulb up, and people realize that that's where that symbiotic relationship exists. But I think, you know, when we start to talk about people, and we've talked about this previously, is a lot of the time lag that exists between a case starting and a case ending, and just sort of the operational aspects of it. And people always want to know, you know, when you get a case, like what's the path that you take, and, you know, how do you do the investigation? And, you know, we were talking about this before we started this recording, and Matt came up with a good point. So Matt, I'm going to turn it over to you because I really want to have you start on the focus about, because you do some of our process improvement reviews, as with Jason on some of our clients, and you just finished one up. But, you know, you made some good points earlier, and I just want to be able to get your thoughts on some of those points about how really when you get an allegation, like where that path is.
Sure. And when you get an allegation, you have to take the path one step at a time. And the first step is to determine whether or not that allegation has any merit. And that's a two-tiered thing. And we'll talk about the first step of that, which is merit. Did what was being alleged actually happen? You know, so that's the first step. So what you do is you have to look at the data, perhaps do some, very preliminary interviews of beneficiaries to see if what was alleged actually did occur, and was there a pattern of it. So that's one way to determine the merit of an allegation. The other is, and it's a little bit broader, and maybe perhaps the next step in the planning stage is, okay, so what? What is the materiality of that allegation? Who cares? Does a U.S. attorney want to prosecute something like that? Or is this something that is administrative in nature, or something you take to a local prosecutor, or through, whether it's a referral to the OIG, through their civil monetary penalty law administrative action? So those are the first two things you have to do to determine, is it worth pursuing? And if so, what's the end game for pursuing it? Are you taking this administratively? Because there are different steps you have to take and different priorities you put on something depending on where you think it's going to go. And those are the first two things as a UPIC director and as a manager, and Wade, I'll turn it to you as well, as a manager of caseloads. These are the things I'd want my investigator to do first.
So, you brought up a good point, Matt, and I do want to go to Wade next. And this is for me, the takeaway on that one was, who cares? Meaning the materiality. So is it a distinction without a difference, or difference without a distinction, whichever way you want to put it? Meaning, I think for some people, it's, if there was no financial impact to billing one thing over another, and it's really a technical violation, is it something that's worth pursuing? So the example that, we see all the time on our SIU side, and I see it when I do work on our litigation side, with providers and compliance is, for example, if a provider submits a claim with an evaluation and management code and they put on modifier 25, for example, but there's no other codes that are submitted, right? So the modifier 25 is not going to have an effect on payment in that instance. It's clearly a misuse of the modifier. And I would be recommending, for example, to the provider community that if you're doing that, even though there's no financial impact, you're putting yourself on the radar by becoming an outlier by the overuse of the modifier. But it really does become a who cares, right? So in the CMS world, CMS could take the position and say, we're going to deny this claim because there's a false statement on the claim or something that's wrong on the claim. It's not what we would consider a clean claim, right? And there's a regulation about clean claims, and most states have rules that are known as the clean claim rule or something like that, where, essentially it talks about free of errors and omissions, whether something should have been there or an error, meaning the modifier 25. But I think the who cares piece is a really important piece of the puzzle. So Wade, I want to go to you because outside of having been an agent and then an ASAC, you're currently one of our senior people on one of our SIU contracts on the Medicaid side. And the who cares piece is an important piece throughout that whole process. And so let's talk about sort of historically. As an agent, I know that if I went to a U.S. attorney's office where I had a laundry list of allegations, I knew walking in that the U.S. attorney's office wasn't going to care about my laundry list. They would say, which is the most egregious, which is the one that has the best jury appeal, right? But now as an ASAC, assistant special agent in charge, you're oftentimes having to go to the U.S. attorney's office and go to bat because an agent was turned down and come back and, they come to you and say, hey, Wade, I had 10 allegations. They only want one. What's your process? Like, what are you thinking? And then let's bring that into today when you're sitting on our SIU team on one of our Blues contracts. You're having similar instances, but now your audience isn't necessarily the U.S. attorney's office. It's in-house counsel. It's potentially the state Medicaid fraud groups and the like.
Yeah. So like when I would get leads that I'm going through, we get way more leads than we can assign and work. So I might get on any given week, I might have to go through as many as 100 leads and decide what we're going to work and what we're not. And it comes down to really two things. It's our office's kind of threshold and what we're looking at, but I also have to know, I have to be familiar with what the U.S. Attorney's Office wants to work. So it's like, first I'm looking at the loss amount, because depending on which part of the country you're in Los Angeles, I know that the U.S. Attorney's Office is probably not going to take any cases, and they won't put this in writing, but if it's less than $1 million, it's probably not going to be worked at the U.S. Attorney's Office unless there's some other egregious element of it, like patient harm. Then that's a whole different story. But we also have different prosecuting avenues available to us. So if it's a case that I think is good and the elements would be easy to prove, and as Matt kind of started with, you first have to look at the case on what's the violation, what's the statute that addresses the violation, what do I have to prove in order to pitch it to the U.S. Attorney's Office, what are the elements that we're going to have to prove. So I have to kind of run through it myself, knowing what the U.S. Attorney's Office is looking for. And then I have to talk to the agent, get kind of their preliminary take on, say, for example, if it's a kickback case, how are we going to prove the kickback? Are we going to do some undercover or some consensual monitoring? We have to have an actual payment or maybe 3 payments in order to prove that part of the case. So stepping back, I do that initial kind of once over, and then probably just the agent initially would meet with the U.S. Attorney's Office. But it's very important there for them to say, this is what I have. And as you said, Eric, there might be 10 or 15 allegations. What's the best allegation to work? What's the easiest to prove? What has the best jury appeal? The other allegations maybe don't all have to be proved, but you can take in relevant conduct, and that will help with sentencing. But the agent has to go to the U.S. Attorney's Office is our first choice. If they won't take it, they can go to the Deputy Attorney General or the District Attorney's Office. or even down the line, we'd even taken stuff to the LA City Attorney's Office. But the U.S. Attorney's Office is our primary prosecutor. So once the agent and I have talked about it, the agent meets with the prosecutor at the U.S. Attorney's Office and goes over what the allegations are. They have to come to a consensus on what needs to be proved, how you're going to prove that, specific steps. So it goes from kind of a broad sense to a very granular, what has to be proved in order to charge this case. They come to a consensus on what needs to be done. And then at that point, the agent starts working. He's probably going to get a to-do list from the prosecutor, and there's a checklist of things they want done: interviews, monitorings, maybe some undercover work. And then to keep the case moving, the ASAC, myself, or the other ASACs will have case file reviews. I think they were quarterly usually. I think at one point we were doing them a little bit more frequently because we're trying to keep things moving. We don't want, some agents would talk about cases being on the back burner, and it's like you can't back burner a case unless it's maybe you're waiting for records or there's some legitimate reason that's out of your control. There can be, a lot of time lapse between certain elements of the investigation, but to just back burner it for no real reason is not something we want to see. And if that's the case, maybe the agent has too heavy of a caseload. So if they're back burnering cases, maybe I need to take that case, make sure it's still on track with the U.S. Attorney's Office. But if the agent is not able to do the work, we either assign a secondary agent so they can kind of work it in conjunction with each other, or just reassign it. But at that point, the cases need to be reviewed every couple of months, and then it's just a matter of, 2 months ago we said you were going to do A, B, C, and D. It's 2 months later. Has A, B, and C been done? And if it hasn't, why not? But that's really the key to make sure that you get a commitment from the prosecutor. If I do A, B, and C to prove, the statute X, Y, and Z, then you'll pull the trigger and charge the case.
So so let's talk, before we move over to Jason, let's just talk about, as you sit here today with us here at Advise, you're spending your day embedded in an SIU on a Medicaid contract. And it's a different audience, right? It's not inherently the U.S. Attorney's Office. It's not even the state prosecutor's office, because there's this whole concept that was foreign to all of us, which is provider abrasion, right? You have providers that are in network and they are voluntarily in the network, and some of them are large practices. And so the payer community needs to kind of create this balance between enforcing the rules for payment and not aggravating the people who are rendering those services, and then potentially leaving the network, which has a lot of negative effects, both from optics and in practicality. So, you're doing similar type of investigations where there's fraud, waste, abuse, compliance issues. How do you see the big difference from the process of, hey, I've got this allegation and I think it's a founded allegation, pitching that to general counsel, who have to approve any discussions of settlement, right, outside of kicking a provider out of the community?
Yeah, and some of the cases that with the SIU, it's similar to the OIG, where in the OIG we would pitch it to the U.S. Attorney's Office, like I was just talking about. With the SIU, there's less of it pitching it to a prosecutor. But if it's a case that we see and kind of doing the same analysis, if I look at it and I look at a statute and I say, I think this is violating whatever statute, and I know that I have to do, again, X, Y, and Z to prove that, instead of pitching it to a prosecutor, you pitch it basically to like the Medicaid fraud division and see if they want to work it. And if they have interest in it, they would likely or hopefully refer it to the Medicaid fraud control unit, the MFUCU. So that's one angle that we like to look at. Another is we do a lot of prepayment review, where if we see a potential issue, we'll request records. Like a lot of times it's just CPT code specific. If someone's billing a code that we feel is inappropriate, or maybe it's just really an outlier and they're billing way above their peers, we'll put them on a prepayment review where anytime they submit that CPT code, the claim is denied until we get supporting documentation to either support it or deny the claim. So this could be as few as, 50 or 75 claims. And if they submit the documentation and it looks good, we take them off prepayment review and everything's goes back to normal. If it's really problematic and they're billing something that we think is inappropriate, a couple things can happen. You can either provide some kind of education. Maybe there's just a more appropriate code. If they're actually doing the procedure and it's just the wrong code, it might be an educational thing. If it's more of a fraudulent type situation, then we can request the money back and maybe do more of an audit where you go, if it's a certain code that you're finding problems with, you go 18 months prior to when that prepayment review went into effect, and then ask for a sample of those records and basically come up with an overpayment request from that angle.
Yeah, it's interesting stuff. And so, Jason, I want to go to you. And I know a lot of times when we talk, I always talk about Matt being a process improvement mentality, right? So, he was intrinsically involved in improving the Northeast UPICS process. And you're really an operational guy. So you're really about like, how are these moving parts all working together? And, what I want to talk about is outside of you being the Western UPIC director, when you first retired, and you, before going to the UPIC West contract, when you first retired from OIG, you were running the Medicaid integrity contract for a contractor that oversaw 34 states, which really, then creates an issue operationally. You've got potentially one team of SIU investigators, but they are working in 34 different environments. And so what are some of those challenges? Because I have to think right off the top of my head, first of all, you've got 34 states, which means you have 34 different sets of statutes and regulations. Some statutes might criminalize fee splitting. Others might, or kickback. Others might make it a civil statute. Others might be silent. You've got 34 different MFUCUs. You've got 34 different single state payers or things of that sort. What are some of those challenges that from an operational perspective you have to overcome, but also have to work within?
Thank you. So, yeah, it is complicated, but it's about one keeping their eyes on the ball. And it definitely relates to things that all three of you said, and you really have raised some excellent points. So maybe just some amplification to provide some additional context. So, Eric, you started out by talking about the OIG being the SIU of Medicare. And to your point just now, frankly, in 2006, and we've talked about this on other podcasts, the Deficit Reduction Act of 2006 then put program integrity in Medicaid squarely into a primary responsibility of the Office of Inspector General. And frankly, Matt, had oversight of Medicaid program integrity from headquarters point of view, probably more years ago than he wants to admit. Yeah. But, so it's not just Medicare, it's also Medicaid. And you just raised also the fact that Medicaid is a state administered program, basically. And so back to the point that Matt raised earlier, which is, okay, what do I need to do to prove this investigation? And, either refute or prove the allegations. So knowing those statutes is key. And you raised a good example. There are some other weird things, like some states, when it's a service too soon, it's the first service that's recouped. In other states, it's the second service. So knowing those details will help you greatly. Then to Wade's excellent point, it's and to yours as well, Eric, there are many different cooks in the kitchen. So it isn't even just the MFUCUs. Some states have OMIG, some have state police units. So when it's a prescription drug concern, they might be covered by state police. But all of those things also, to Wade's point, give you that opportunity of many more places to potentially prosecute that case than just the U.S. Attorney's Office, because the thresholds there, and that word I don't think has been used yet, but it's important to note that there are more unofficial thresholds of what a particular U.S. Attorney's Office would consider. Um, uh, I don't want to use the word worthy, but just that since resources are limited, of that it would meet the needs of that jurisdiction. So in Montana, the maybe their thresholds are different than in the Central District of California, and so all those things matter. The other thing is that I want to bring up is that there's more than just a criminal prosecution, right? So if you're talking about a criminal prosecution, you're talking about having to prove intent. Proving intent, and and in a criminal prosecution in general, making that level of proof sufficient to be, um, you know, uh, found guilty by 12 people on a jury, most likely, of beyond a reasonable doubt is a huge bar. Yet, if you think about the O.J. Simpson case from many years ago, they couldn't prove it criminally, but on a civil prosecution where you're looking for a preponderance of the evidence, well, yeah, that was a threshold that could more easily be obtained. And the OIG has very unique statutes that allow them to be even more powerful. There are administrative prosecutions, more or less, that can happen, right? It can be that maybe it's administrative, that they're on a corporate integrity agreement, or things of that nature. But civil monetary penalties can be a huge impact on a provider's practice. So one other thing I want to amplify on is what we brought up, and maybe Matt to that extent too, is about documentation. So, or actually you too, Eric, sorry, I give you credit as well, is that it is just as important, well, maybe I'll qualify that. It's very important to document inactivity as much as the activity itself, because it says something about the quality of the investigation if someone picks up a case file and sees that for 6 months this thing was just sitting there. And there might have been good reasons for it. It might have been records. It might have been expert testimony that was. It could be any number of things that protract that languishing period. But having a reason for it doesn't give the defense as much opportunity to poke holes in, like, so was this really that important that it just sat there for 8 months, or, without anything happening? So I would highly recommend that there be regular and contemporaneous documentation of all periods and facets of the investigation, not just the sexy parts that, um, produce some sort of evidence or witness. That's very important.
Yeah, so those are really important points. And one of the important points really is, so this whole premise of intent. And I think, when we look at a lot of press releases that come out from the U.S. Attorney's Office on various cases, where when you read the press release, the facts and circumstances that are provided to the general public will make you scratch your head and say, why was this a civil case? Why wasn't this criminally prosecuted? You see these cases where the headline tagline, sometimes it's almost like clickbait, but the tagline says, provider agrees to $2 million in fines from settlement for kickbacks. And everybody immediately on the social media, gets out and says, why wasn't this criminally prosecuted? And why is this not going to jail, and what have you? And the issue really is always that proving of intent, because at the end of the day, that's what you have to prove. And so you may be able to prove something from this preponderance, but not from this beyond a reasonable doubt. We've all experienced this in our criminal cases, where the defense will get up and put the program on trial, right? The rules are confusing, the policies aren't consistent. We see this with LCDs all the time, right? LCDs do not have the effect of law, because they are not subject to the 60-day comment period. And so you may find in 2 different MAC jurisdictions, Medicare administrative contractors who pay the claims, that there may be a policy in one jurisdiction and not in another. And it's just, the nature of the program. And so defense attorneys will often capitalize, on that. Now, to your point, Jason, about the administrative piece, yeah, there's a little bit of it is, criminal division of the U.S. Attorney's Office says no, civil division says no. You can go to Office of Counsel to the Inspector General. In a future episode of the Roundtable, we're going to have a former OSIG lawyer come on, and we're going to talk all about that. We're going to talk about CMPs and sort of the interplay that CMPs have, because they do touch upon a lot of things like the self-disclosure protocol, the administrative permissive exclusions, all of that kind of stuff, kind of parlays into that. But, I think to kind of bring this to a close, the important piece of this puzzle is that there is no roadmap that you can set for one particular SIU or the OIG. But even more importantly, I think that, getting back to Matt's initial point was, is there a problem? And then who cares? And how do you go, how do you kind of figure that out? So Matt, I want to have you do the close on this, because you've done a number of these process improvement reviews. First of all, you did it for the Northeast UPIC. And I always pick on the Northeast UPIC because it was my UPIC and I know the people there forever. And so I don't pick on them in a bad way, but at the end of the day, I always looked at what the UPIC did and always said, well, is what they did good, bad, or indifferent? Who cares? But, from a process improvement perspective, and I want to give you the last kind of say on this, is what should be in a policy? And I know I'm being very broad on this, but generally speaking, what are the important kind of highlight things that an SIU should have as a policy and procedure? Just, kind of if you were throwing a lot of stuff against the wall, what are the top 3 things? We'll kind of narrow it down to even that. What are the top 3 policy and procedure related things you believe should always exist?
Okay, so in following up on what Jason was talking about, documentation. Similar to a payer saying a service wasn't rendered unless it was documented, for an SIU, your investigation wasn't conducted unless it was documented appropriately, because that is the lifeblood of any investigation. And for any remedy from that investigation, any resolution, it's going to be based on that documentation. The other is having a good internal quality assurance program. Wade talked about the file reviews every quarter, every 60 days or whatever it was. I think it changed back and forth in the OIG. Having that same type of internal quality assurance contemporaneous with the ongoing investigations is absolutely important, because it will show the supervisors and the investigators, where, what needs to be bumped up, what needs to be prioritized better, what investigators might need some help. To Jason's point, what cases need to be documented better? Why is this one lagging? Well, if that's the case, get that documented. All of that has to be done as the investigations go on. It's very important. And the third would be prioritization. There has to be a very established prioritization program, whether that's an artificial intelligence program that you create, or it's just going out knowing what the priorities of your customers are. What are the priorities for the UPICs? What are the priorities of the 3 OIG regions that the Northeast we're feeding referrals to? For the West, it was how many regions did you have there? 3 or 4 as well, Jason? For OIG, all of those have different priorities, and those priorities are based on the priorities of the U.S. Attorney's offices that they answer to. On the Medicaid side, what are the priorities of those different states? What are the priorities of CMS? How do you mesh those and then come up with resource allocation in line with all of those priorities, so that you're not wasting time on investigations where nobody cares, or they care, but it's just you're never going to reach the resolution that you want. So those are the 3 things I think: quality assurance, prioritization, and documentation.
Hey, if I can just interrupt and add one thing, because those were excellent points. And there are very few axioms in the roadmap, which has been said several times. The one I will suggest is an axiom, and it's an attribute in terms of the allegations, and certainly if it was proven in it would be extremely important, and that has to do with patient safety and if there's patient harm, it's going to rise to the level, and it should, each and every
Absolutely.
time.
Right.
Yep.
And we've seen that. We've seen that. And, I know we've talked about this before, and it's probably the seminal case that the OIG worked, and that's the Dr. Freed Fatata case out of Detroit, right, where the allegation was that he was providing chemotherapy treatments to patients for cancer that they didn't have. And I believe that case from date of complaint to arrest was, like 3 or 4 or 5 days. It was very short. It became all hands on deck. Because of the potential of patient harm and likely patient harm, right? Giving chemotherapy to patients who don't have cancer, one of the side effects is you give them cancer. And so, right. So I think that's an important piece of it. That prioritization is inordinately important. And just to kind of close out on this, we know there are districts, and I worked in the district, and Matt, this, Wade and Jason, it. There are some U.S. attorneys' offices that don't have an appetite for certain kinds of cases. And so when a case would come your way and you knew that it involved allegation XYZ, you knew the U.S. attorney's office wasn't going to work it. So, you never really had to go too deep. You would just call the U.S. attorney's office and say, I have a case involving XYZ, confirming your declination, so you can then go to OSIG. I used to always say OSIG was like Mikey from Life Cereal. Just give it a Mikey. They'll take it. They'll take anything. But it is part of that process.
Well, one old guy story. So in New York, the Southern District of New York, which of course always has all the prosecutions for overseas matters and everything, and I just remember sitting with the then chief of the criminal division, and I was wondering, like, well, do we have venue here? And he has a globe in the back of him, and he spins the globe. He said, that's the jurisdiction of the Southern District of New York. So any of the viewers that know the Southern District would know that to be a true story.
Well, the Southern District of New York forever and a day has been known as the Sovereign District. And I remember, Jason, you may remember this, but we worked on a case back in the mid 90s. It was a podiatry case out of New York where the Southern District's venue was in part, it changed, but the initial discussion was when the reimbursement checks, which at the time were hard copy, when the reimbursement checks were mailed, what was the path that the mail truck took? The check ultimately was going to a provider in Brooklyn, but was processed out of the Medicare contractor in upstate New York. And the argument was, did the mail get processed through the GMF, or the General Mail Facility in Manhattan? And the answer was yes. And to which the U.S. Attorney's Office said, well, then we clearly have jurisdiction. So, there are creative things. Also, we don't get too deep, but, defendants can waive venue by their own choosing because they feel it may be in their favorable interests based upon relationships and the like. We can go on and talk about these things forever, but I think it's important, the closing part of this is that the playbook really is something that is fluid. And it's ever changing, and it's a little bit like the OIG work plan or OIG investigative priorities. It's no different here at Advise. One thing I will say is the closing is one of the important pieces of the puzzle that we bring to the table is the fact that when we do our work on the SIU side, we have our subject matter experts such as ourselves who bring both the investigative healthcare piece, the law enforcement piece, and then we speak both healthcare and we speak legal. Right. And that becomes important. So we have the ability to do that liaisoning. And what you guys are going to be seeing in the next couple of weeks is we're going to be doing a press release, and we're going to be announcing yet another addition to our team, someone who is a known quantity in the Medicaid space, who will really be able to help create a little bit more of that symbiotic relationship that needs to exist between the state, the prosecuting and regulatory authorities, and the SIU with the law enforcement community. So these are pieces, I think, that oftentimes fall to the wayside because the sometimes smaller SIUs don't have those resources to understand like who to go to when they have a referral. How do they put one together? How do they pitch it to law enforcement? How do they pitch it to a regulatory community? So, you know, these process improvement pieces, the operational pieces are all, you know, really challenging. And I'm honored to have you guys with me because I learn something every time we do one of these talks. It really does provide some education to me. So I know that everybody who's listening is probably also getting a little bit of education. So that being said, we're out of time as always. It's great having you guys, Matt, Wade, Jason. I love spending the time with you as always. Have a great day. Everybody, thanks for tuning in. Again, if you're not getting our newsletter, you can send us an email at hello@advise, ADVIZE health.com. We'll get you on that newsletter. And always tune in on LinkedIn to our LinkedIn Lives. We've got one coming up on the 10th of January, I believe, and that's going to be Jason and I talking about hospital fraud for a lunch and learn. LinkedIn Live, we're going to be talking about a few things involving DRGs. We're going to be talking about emergency room visits. We're going to be talking about the 0 and 1 day stays and things of that sort. We're going to pack a lot into the 30 minutes. So as always, we appreciate your time. We appreciate your support, and we'll see you next time around.
Thanks.
Thank you all.
Thank you.